When we talk about sleep disorders, there are a range of disorders that can be included under this criteria. There are almost 80 kinds of sleep disorders that are present. The most common are the insomnia, which we've already discussed. Basically, it's the inability of the person to fall asleep and remain asleep. And over here in this section, we are discussing another sleep disorder, which is known as narcolepsy, which is basically characterized by the excessive fatigue and the excessive sleep disorder in a person. So whenever a person is suffering from this kind of a narcoleptic disorder, basically his or her daily life activities are affected due to this narcoleptic activities. And so one should know how to deal and treat with these kind of disorders. In this particular section, we'll be focusing on the causative factors. So whenever we are discussing the sleep disorders, the causative factors usually can be distinguished between the personal traits of the person, the personality traits of the person, any happenings that are making the person more anxious or more curious, depressive in his or her states. And then there are a lot of environmental factors that can play their role in the development of these sleep disorders. Again, excessive fatigue can cause a person to fall asleep for long periods of time. So these are the causative factors that can contribute to the development of this kind of a condition, which is known as narcolepsy. So we'll be discussing all of these causative factors over here, and then we'll be moving on to the statistics that basically correlate to this condition, which is known as narcolepsy. The epidemiology, the occurrence rates, the prevalence rates will be discussed over here as well. Then we'll move on to the treatment guidelines. Whenever we diagnose a person to be suffering from this condition, which is known as narcolepsy, what are the different kinds of treatment modalities that are present these days? That will be discussed over here in this section. So first of all, defining or identifying this condition, which is known as narcolepsy, it is basically a chronic sleeping disorder. So usually the person is fatigued most of the time and there is a chronic sleeping disorder. It's hard to stay awake for longer periods of time. This is the presenting complaint usually, which is given to the clinician by the patient. So this is the highlight of this condition over here. Then there are sudden attacks of sleep. So this is one of the other characteristics of the narcoleptic condition, that the person will give you a history of sudden attacks of sleep, can fall asleep under any circumstances. So these are the particular conditions that the patient is suffering from, and this is how you basically have the suspicion that maybe that particular person is suffering from this particular or a peculiar condition, which is known as narcolepsy. Now, moving on to the symptoms of this narcolepsy condition. First of all, as we've already discussed, there is excessive daytime sleeping. Then we have the sudden loss of the muscle tone, which is also observed. It can be characterized as a state of unconsciousness that is observed by the people that are surrounding that person. Whenever you get a collateral history from the primary caregivers, they'll give you a history that there is a sudden loss of muscle tone and there are sudden attacks of sleep in that particular person. So sleeping paralysis is also observed or experienced by these people a lot of times. Then they also experience a lot of conditions of hallucinations that are experienced by these people. These hallucinations can be tactile, they can be auditory, or they can be visual in their experience. So these are the different kinds of hallucinations that can be experienced by the person. Then we have the low levels of hypocretin and the orexin. So these are some of the biochemical markers that can make the diagnosis of the narcolepsy more evident in that person that whomsoever we are investigating on. The causative factors, they are not exactly known till now. Most probably, obviously, all of these factors, they can be, the most important role can be of the genetics in these people, which make these people more prone to the development of this condition. Then infections, for example, encephalitis can be one of the conditions. A recent history of encephalitis or meningitis can basically lead to the formation of this condition, which is known as narcolepsy. Then sleeping pattern, non-REM plus REM, both of these patterns are affected. Whenever we investigate such patients, hypocretin levels are raised, orexin levels are raised in these people. Then H1N1 vaccination is sometimes given if we think that this sort of a condition is aroused in a person due to some sort of an infectious state, then this sort of a vaccination can be given to the people. So these are the range of the causative factors that are still being worked upon, and we still don't know whether it's a genetic condition that is more prevalent in a person, or whether it's the infectious state which make the person more prone to the development of this condition. Now, when we come to the statistics and we discuss it, the age of onset of the narcolepsy is variable. If you look at over here, it's the most prevalent age group is between 15 to 20 years of age group. These are the people that are more affected. Then we have another group that is almost 25 to 30 years of age group that can also be affected. So this is the most likely age group that can be affected by this condition. Most common age of diagnosis is 20 to 40 years. So roughly we can make a pattern of 20 to 40 years in our minds that this age group is more effective to be more effectively develop this condition, which is known as narcolepsy. Now, 0.05% of population worldwide is affected through this condition, which is known as narcolepsy. The treatment guidelines, obviously, there is a range of treatment that can be available. There are a lot of medications. Then we have the cognitive behavioral therapies. We have the counseling sessions that can be conducted with the patients. And sometimes all of these are coupled along to get the better results in that particular patient. So usually there is no cure, there is no 100% cure, but still we can try and make an improvement in that patient. Sodium oxybate is used, which is known as Xyrem publicly. The treatment guidelines, the stimulants that are usually used are the modafinil. So it is one of the drug which act as a stimulant, and that can be used in the patients of narcolepsy. Methylphenidate, it again acts as a stimulant in these patients. And then we have SSRIs, that is the serotonin reuptake inhibitors that can be used, and that basically includes the fluoxetine, and then we have the venlafaxine. So these are the drugs, these are the SSRIs that can be used for the condition known as narcolepsy. On the other hand, we have the tricyclic antidepressants. Now, this group basically includes the protriptyline that can be used if the person is in some sort of a depressive mode or he's passing on through a depressive episode. These tricyclic antidepressants, they play a pivotal role to take him out of that particular condition. Imipramine and clomipramine, they can also be used for these treatments. Then we have the different complications of this narcolepsy. So whatever the condition is, there are a lot of psychiatric complications that the person can go through. There can be a public misunderstanding that can arise in the people. Then we have the feelings and the relationships can also be affected through this condition. Obviously, it's very difficult for the people surrounding such a person. Either they can be the relatives or the friends and the families that they can be affected indirectly. Physical harm is sometimes these people go through this state which is known as the physical harm or the deliberate self-harm that they go through. So counseling is very important for this complication. Then obesity is one of the conditions that can arise as a complication in the patients of narcolepsy. So in this particular section, we focused on this condition which is known as narcolepsy. That is basically sleep disorder. What are the causative factors? What are the risk factors? And then we also discuss the complications of such a condition. So that is the end of this section. Thank you for watching sqadia.com.